Okay, we're joined now by the Minister of Health, Professor Onyebuchi Chukwu, who joins us from our studios in Abuja. Morning, and thank you for joining us today. Well, there was a lot of surprise and shock in many quarters yesterday when afterward they heard you address the press conference about the Nigerian doctor who had tested positive on this Ebola. Could you start by telling us, well, what is new about this now? Because afterwards, after they heard that, the first question that came to mind was, wait a minute, I mean, the first night that or the first day that they attended to the patient, when they didn't know that it was Ebola, what could have happened? Could you tell us something about that?
Well, thank you very much. Good morning. Well, normally in this business, we don't like to speculate. We'll probably have to wait until we have investigated. You can even see that in other countries and in other situations, health workers, even when all precautions supposedly have been taken, sometimes could still get infected. So you only need one single breach in the procedures to really be at risk. So we wouldn't speculate, we'll look into it, but all over the world, it's known that health workers are the most vulnerable when it comes to viral hemorrhagic fevers, of which Ebola is one of them.
Okay, could you tell us now, if you could recap for those who might have also missed the news, you did address the press conference, a female doctor. Do we just have one case, or are there two, or do we have more people who have shown some symptoms? What is the status of this one now?
Well, you will recall that I had informed the nation that altogether we have placed 70 primary contacts of the index case. The index case is the imported case, which of course now is history. The man passed on. So 70 persons are currently under active surveillance. But because what we normally do is once you begin to show any symptom, no matter how mild, we then quarantine you. We now have 8 persons under quarantine in Lagos. So what has happened is that we had investigated, if you recall, sometime last week I did report that 2 of the health workers who had fever were tested for Ebola virus disease and they came out negative. So it's a continuous process. So in this case, this has turned out positive, and that's why we say we've been able to confirm the second case of Ebola virus disease in Nigeria, but the first one in a Nigerian here in Nigeria. So that is the situation, but also some other health workers have symptoms. It's just that the result has not been have not been notified of the results, but as of yesterday, their samples were being tested in the laboratory. So we are maintaining that surveillance, and in terms of contact tracing, the harder part of the job is actually following up on the secondary contacts, and then the third degree contacts. It's a lot of work involved, but the government is determined to carry on.
One of the things that comes to mind is that when this disease, first of all, was mentioned in Guinea, Sierra Leone, and Liberia, there was a meeting of health ministers across West Africa in Ghana, in Accra. But people will still wonder what was the outcome of that particular meeting and how come it did not result in things that could, have prevented its spread to other countries.
Well, that meeting, Nigeria participated in the meeting in Accra, Ghana. One of the outcomes of that meeting, which was facilitated by the World Health Organization, was the establishment of a coordinating mechanism for all the ECOWAS countries plus some of the Central African countries on how to ensure that we share common strategies, common best practices, and that we're able to share information as we moved on. Now, what has happened is just simply unfortunate because this man who was the index case was warned by his own country, even his government, said don't travel. And how he ended up traveling and not disclosing full information to those who were asking. Even on the hospital bed, he was still denying. So it's just unfortunate that he just brought this into Nigeria. But then it tells you that every country of the world is indeed at risk. So we have a common understanding, but what happens is that as the problem goes on, we review our strategies. Even this week, the WHO is meeting in Geneva to review all the strategies that are in place and to see whether anything more drastic could be suggested. But even in country here in Nigeria, we're working as a team, federal government, Lagos state government, other state governments, WHO, US Centers for Disease Control and Prevention, CDC. We are working as a team, and we continue to review the strategies we are putting in place. But what is important, whatever strategy we put in place should enhance the prevention or spread of this disease. It shouldn't be counterproductive.
What exactly would you say, sorry, Nyota, what would you say is the focus of the strategy? Is it prevention? What exactly is the thrust of the strategy you are employing? Because there are concerns. A lot of people say that the focus seems to be more on, travel by air and, entry through the airports. There are also concerns as to what goes on in our land borders.
Yes, you are right. But what are the strategies? The first one is communication. Beyond information, we need to give information, but we need to communicate properly to the public. This, the federal government and the state governments are doing so well. The president himself also assisted the Federal Minister of Health by constituting and inaugurating an interministerial committee for communication strategy. And 8 ministers that are relevant are serving on that committee, and they have the mandate to, co-opt any other minister that is needed. So based on that, we are working with the Minister of Information, who chairs that strategy committee. We are working with the Minister of Communications Technology. We are working with Minister of Foreign Affairs, with the Minister of Agriculture, Minister of Interior, Minister of Aviation. They are all part of this team, Minister of Science and Technology. So information, communication is very important. I think we are doing very well on that. And we're not restricting it to conventional channels of information. Yes, now we have, since March, we've had jingles on television, on radio. But what is important now is that we are widening the scope. The private media houses are coming onto it, even ready now to sponsor this free of charge. Although what I've not seen on channels is to see the scroll of our website, which we have announced, www.ebolaalert.org. Now, that is an interactive website. You get information, but you can also complain, you can send information, you can ask questions, you can make suggestions. It's interactive. Now, we have a toll-free telephone number for the populace, very dedicated, 0800 Ebola help, 0800 Ebola help. That is available. We have opened accounts on Facebook. We've opened accounts on Twitter. These are all mechanisms. We have email dedicated for communication. But the Federal Ministry of Information is also helping out with grassroots communication strategy. They have the structures in place in every state of the Federation. So we're going to use the information officers to try and reach the grassroots. We're going to have meetings and encourage the faith-based organizations to understand what the disease is and explain to their congregation. So we are communicating, we are talking to the media regularly. Press conferences will be a regular feature, and we want to be as open as is necessary and as is possible, and we are communicating very well. Now, what are the other things? Diagnosis. Now, we have expanded the facilities for diagnosis in this country. I have been in touch with our development partner, and they seem to be impressed with what we have in the country, but I think we can still upscale. Now, the other strategy is the border, which you rightly mentioned. We are working on the border. If you go to semi-border, you find that passengers are being screened. Even we are also using infrared handheld equipment to dictate any rise in temperature. We have reviewed our forms, which travelers by air must fill before they land at the airport, and we're also doing screening for temperature screening even at the airports in Lagos, in Abuja, and we are also now sending it to other international airports. Now, just 2 days ago, through the appropriate ministers, we directed customs to ensure that nobody brings any corpse from any of these other countries that are affected. Through the Minister of Aviation, the aviation operators have been instructed not to allow any corpse to be brought into the country through this. So we are doing quite a lot on communication strategy.